The East African Community Regional Center of Excellence for Vaccines, Immunization, and Health Supply Chain Management stands as a beacon of knowledge and progress. Established with a vision to become a regional knowledge hub, providing high-quality pre- and in-service training and disseminating best practices in the fields of vaccine, immunization, and health supply chain management, the center is making remarkable strides. Indeed, since 2017, EAC RCE has been offering the master's program in health supply chain management and nurturing great minds in the region in this field. As alumni ventured into their careers, they were armed with not just degrees, but with the tools to make a real difference.
I am a health supply chain consultant attached at the Ministry of Health, particularly National Vaccines and Immunization Program, and also supporting Division of Disease Surveillance. What made me to be motivated to join Masters in Health Supply Chain is because I'm a health supply chain practitioner and I wanted to improve my skills. Every content that I learned in class, I find it useful to date. As the biggest beneficiary, I've been exposed to support bigger teams than I was supporting when I had not done this course.
What motivated me to join the Center of Excellence? During my career, sometimes in supply chain you face challenges and you don't know how to handle them because you didn't face those experiences around the supply chain, and you opt to gain more knowledge in your career so that you can handle the challenges in supply chain, even though you cannot handle them as a standalone individual, but still you need upgraded skills so that you can communicate with others with different skills and knowledge, so that you may come up with adequate solution to encounter challenges.
I've been growing in the expertise of supply chain management, especially on the immunization supply chain, as one of the experts in the immunization program. And this is taking us furthermore on how best we are going to improve the health supply chain management in our countries, ensuring that we have commodities of good quality in every place where clients need those services timely. And this is then another chance for building others who can also benefit from this chance of having increased their capacity in terms of health supply chain management. I do concur for the University of Rwanda having this Center of Excellence under the East African community to have more graduates who could be coming, to increase more numbers of students who will be having these chances and the capacity to develop under the supply chain management in the East African region, but also all global situation.
The program provided me the perfect response to the aspiration that I had. The center went all out to get us the best quality instructors throughout the program. So I would call it every product in terms of human resource that this center churns out is one that you can trust. These are people who I could say governments should be able to rely on to deliver and to improve health supply chains within their nations, within the East African community, and beyond, because I believe the curriculum and the contents were organized in such a way that they were so exhaustive and applicable all over the world.
RCE has expanded its programs to include a master's program in pharmaceutical analysis and quality assurance, a Master of Science in Vaccinology, and a Master of Science in Regulatory Affairs.
In these 2 years' time, we are going to deliver a lot. And another important thing in this course, we have integrations. So we interact with different East African. So we can communicate. We have groups in our courseworks that includes each member from each stake. So it's also going to transform all of the East African committee so that we can proceed all together.
Within our month of studying starting of this program, I have seen that is a very important program. we learn theory, but also we do practical. That upskills us in order to see the material that we are going to use, that we are need in order to make the product of the good quality that are on our place, but also what we are going to tell our investors in the health sector what they have to do, such materials, contracts, and they are need in order to get the product of the good quality.
My motivation for choosing this program of master's degree in pharmaceutical analysis and quality assurance is that this program will help me to enhance my qualification and expertise so that I can impart it to my students as an assistant lecturer. At the end of this program, I know that this program will enhance my academic profile and my teaching capabilities.
RCE commitment does not stop at master's programs. RCE conducts various short training courses, workshops, and upskilling programs to empower healthcare professionals in the field of vaccines and health supply chain management. RCE also remains dedicated to promoting research excellence and knowledge dissemination and strives to make a lasting impact on healthcare in East Africa and beyond.